All right. Thank you, everybody. Welcome, welcome, welcome to the HCAO Labor Webinar. My name is Valdez Bravo. Use he, him, his pronouns, and I serve as president of Healthcare for All Oregon. We're so excited to have you here tonight for our webinar, which is titled Healthcare for All Who Served, Reinforcing the VA, Not Replacing It. We hope that everyone had a nice, whether it's a Veterans Day or Armistice Day that you celebrated yesterday. And we appreciate you continuing the focus and reflection and honoring of veterans by being here at this webinar today. We are Healthcare for All Oregon, a 501c3 nonprofit located based out of Portland, Oregon, but with statewide presence all across the state, advocating for healthcare justice in the form of universal healthcare. We out here in Oregon are the closest to making it real on a state-based level. And we strongly believe that we will be the first domino to fall. And once that domino falls, the other states, whether it's the West Coast block or whatever, that we will be setting an innovative path for other states in the nation. Our mission at Healthcare for All Oregon is to educate and advocate for publicly funded universal healthcare system that will improve the lives of individuals, families, and pretty much everybody all across Oregon. And so we're so excited to have you join tonight for a conversation again about universal healthcare through the lens of veterans. I'm so excited tonight to present our panelists, Suzanne Gordon, Dan Shea, and Betsy Zucker, who I will be further introducing in just a moment. So for our third webinar, we wanted to take a look at how military veterans and their families basically would be uplifted and supported by the implementation of a comprehensive, high quality, equitable, affordable, universal healthcare system, and just how it would improve the lives of, like I said, everyone across Oregon, including veterans and their families. Last week, we did a deep dive on the model offered by Taiwan, where leaders from that system shared with us about their unified, effective, and fair system, which ensures healthcare is available to all of its people. But however, the United States operates in a far different way, which we don't have one system. We have this fragmented mess, which leads to poor access, reduced quality, excess costs, a lack of coordination and care, insurance denials, surprise billing, underinsured people who delay care, or individuals and families having to go without insurance altogether. The United States truly cannot be described as a healthcare system. The United States, again, is just a highly fragmented system of groups at the local, state, and federal level who are all involved in the financing, ensuring, delivering, and paying of healthcare. And the federal government is not only a healthcare payer in America, but it's also a delivering care to veterans through the Veterans Health Administration, and to Native Americans like myself through the Indian Health Service. I grew up on care at the Indian Health Service in Salem. But although I hope to have a panel discussion centered on tribal communities in the early part of next year, and we're looking forward to that one already, tonight we're going to be looking at this topic through the other federal side, through the eyes of veterans. I myself am an Army veteran. I served 8 years at military hospitals, and I went on to work for 18 years at the VA. So this topic is obviously near and dear to my heart, and but I'm only going to be the moderator today. You're not going to be hearing a lot from me other than echoing your good questions. So we're really excited to have this fantastic panel tonight. We are again joined by Suzanne Gordon, co-founder and senior policy analyst of the Veterans Healthcare Policy Institute, and author of Wounds of War, How the VA Delivers Hope, Healing, and Health to the Nation's Veterans. We're then going to hear from Dan Shea, president of Veterans for Peace, Portland Chapter 72, located here in beautiful Portland, Oregon. Dan's a Vietnam veteran, and we've been friends for years. He's such a strong advocate for veterans and for peace. And finally, we'll be hearing from Betsy Zucker, a nurse practitioner and a labor and single-payer activist with Jobs and Justice. Betsy's retired these days as a retired member of AFGE, the American Federation of Government Employees Local 2157, but is still very active in the fight and doing more than ever. So all three panelists will help inform an engaging discussion about the VA's model, about universal healthcare, and I hope the single-payer advocates on this call will leave the call knowing more about veterans issues and veteran care needs, while veterans and veteran advocates on the call leave the call knowing more about universal healthcare. And all of us can think about aspects that should be taken into account as Oregon designs our own state-based universal healthcare system. Now, we're going to hear from the speakers first, But when we get to the Q&A after they speak, we'll have hopefully about at least a half an hour for your questions and discussions. You're gonna be able to raise your hand to ask a question or drop them in the chat at any time during the webinar, and I'll look for those questions and pull them up when the time comes. But we'll work to ensure your questions are answered before the end of the call. So thank you all for being here. And without further ado, I'm gonna turn it over to our first speaker, the wonderful writer, advocate, and healthcare policy expert, Suzanne Gordon.
Hi, thank you so much. Unfortunately, I have a little bit of a cold, so forgive me if I'm hoarse and cough. So I am not a veteran. I have been writing about healthcare for too long, 40 some years, written a lot about nursing healthcare systems, and I've spent the last probably 15 years writing about veterans healthcare. I think that for the purposes of this discussion, I want to hit on a couple of points. One is you are fighting for a universal, high quality, equitable, accessible system. And there is one actually in the United States. We don't have to go to Taiwan or the UK or Canada or Scandinavia or whatever to see a high functioning universal healthcare system that is it's a sort of single payer system. It's a little bit complicated, but it's a socialized medicine system, and that's the Veterans Health Administration, and it works. I would argue that in our, as Valdez says, we don't have a healthcare system in this country, but in our messed up medical treatment non-system arrangement, we don't really have a healthcare system in America. There is only really one genuine healthcare system in America, and that's the Veterans Healthcare System run by the Department of Veterans Affairs. And why do I say that? Because healthcare is way more than medical treatment, and what we have is this broken medical treatment system that doesn't work very well for even medical treatment. But the VA is actually, the Veterans Health Administration runs a healthcare system. It does medical treatment, it does mental health care, it deals with occupational issues, it deals with socioeconomic issues, social determinants of health. It takes care of homelessness and mental health. And it's really a healthcare system. And it is, I would really argue, America's only healthcare system. The VA is also, and this is extremely important, America's only occupational healthcare system, because America does a lot of things very poorly, all of which the VA, when it's properly funded and staffed, does better. Primary care, geriatric care, end-of-life care, integration of mental health and primary care, dealing with all kinds of issues like legal issues and homelessness and so forth. The VA does all that. And the studies show that because it's comprehensive integrated care, that it does it better than the private sector system. But the VA also does something that the private sector system doesn't do, and that's occupational healthcare, occupational medicine. So, for example, Dan Shea was in Vietnam. Because the VA knows what work, he did when he was employed by the Department of Defense, the VA will screen for certain things that it knows were occupational risks for Dan Shea because he was in Vietnam. That's what the PACT Act is all about, right? Kylan Hunter, who is the new executive director of IAVA, Iraq and Afghanistan Veterans of America, was a helicopter pilot in Iraq and maybe even Afghanistan, I'm not sure. But so in the VA, they know that because she was a helicopter pilot, she's at risk for a very rare melanoma that most people don't know anything about, called ocular melanoma, for which she would never be screened outside of the VA. I mean, a 40-year-old woman who's healthy would never be screened for ocular melanoma. But because it's an occupational medicine system and they know what risks she took and bears when she was in the military, they screened her, and guess what? They found it. Had they not done that, she would have been at risk for losing her eye, her vision, and possibly dying. The ocular melanoma, which is, as I said, very rare, has a 15% mortality rate after 5 years. Yeah, I mean, it's an 85% and 15% survival rate, sorry, after 5 years. The VA, and I think this is super important for single payer advocates, because tragically, in my experience, in my now 15-year experience of dealing with the VA, the VA is not only America's largest, but most invisible healthcare system. I mean, we all know it exists. We've all seen those signs saying VA hospital, VA clinic. Hardly anybody knows what happens in there. Nobody knows that the VA doesn't just provide clinical care to veterans. It's the nation's hub of healthcare professional training. 70% of American physicians are trained in the VA, nurses, 50% of psychologists, on and on. It's the second biggest research powerhouse in the nation. Think the shingles vaccine, the first implantable cardiac pacemaker, the nicotine patch, on and on and on. And none of these are like, oh no, you can't have the, a pacemaker because this is just reserved for vets, and so, but I also find that tragically, a lot of healthcare reformers know zero or very little about the VA. I know a lot of docs, for example, who trained in the VA, like in the 70s or 80s. And it's like, oh, I was at the VA. Well, actually, you weren't, because the VA transformed in 1994. So the VA that you saw in 1980, or even 1990 is not the VA that exists today. And a lot of people think, and many doctors included, think that, oh, well, if we had universal health care, we could just dissolve the VA because, vets can go anywhere now. They won't have to pay, they can go anywhere. But one of I think the biggest things, and I know Dan and Betsy will cover this, certainly Betsy, because she treated veterans have very different problems than other, civilian patients. They have higher risk for suicide. They have more chronic pain. They have all these horrible occupational exposures. I mean, regular people, well, actually, a lot of regular people have terrible occupational exposures. Nobody pays any attention to them. They have way more mental health problems. They are exposed to moral injury, and they have PTSD and military sexual trauma. Private sector providers don't know a lot about these problems. A friend of mine who's a veteran went to a private sector provider for her mental health problems, and she said, I'm here to talk about my MST, military sexual trauma. She said MST, and the psychologist said, what's that? I mean, and there really is no reason why the psychologist should know what that is, because women veterans make up like 0.03% literally of Americans' patient population. Veterans represent 3% of Americans' patient population. But a lot of healthcare reformers think, oh, if we have Medicare for all, or some kind of single payer system, or a universal healthcare system, or a national health system, pick your variety of healthcare reform, we won't need the VA because they can just go anywhere. They can't just go anywhere because VA is also a population health system. So just like you wouldn't send an oncology patient to an orthopedic hospital, it's a bad idea to send these very complex veteran patients to hospitals and providers that don't know how to treat their complex problems. They're also very complicated patients, and they can also be kind of grumpy and sometimes even a little dangerous, like lethal, because when they get pissed off, sometimes they take their gun, which they're very attached to, and shoot people. And that's a very small percentage, but there's a very strong problem in the VA with patients who are what they call disruptive. And these patients can't be fired in the VA. They can't be ejected. They can, be escorted and so forth. But in the private sector, they teach people how, they teach providers how to get rid of what they call, disruptive patients. Like, you're gone, we're not going to take care of you anymore. Um, and the VA is just, the kind of integrated care that the VA provides. I wish I had that kind of care. We all deserve that kind of care. Veterans aren't the only people who have served their country. Lots of people serve their country in lots and lots of different ways. And just as we view in this healthcare reform movement, healthcare as a human right, we should, I believe, adapt VA as the model of the kind of healthcare for all that we want. I personally am not in favor for Medicare for all. I don't think we need another payer. I think we need a universal healthcare system like they have in most other countries in the world, which are payers and providers. And I think the VA is an incredible model for the kind of healthcare that we want in America today. So my motto is VA for all, not Medicare for all. And besides, Medicare has been so compromised by the corporatization and private equitization of healthcare that I think we should really just go for the gold. And most folks that I know who are healthcare reformers really would want some kind of socialized medicine system like the VA is. When I say VA for all, I don't mean that 330 million people should descend on 170 medical centers. That's a crazy idea. But I think that we should be fighting for a model like the VA. And I think we have to be super careful when we're talking to veterans that one should never say, we won't need the VA if we have a single payer system. We won't need the VA if we have Medicare for all. Having a single payer system, having a universal health system, or having, even Medicare for all would theoretically take away the incentive to privatize the system, which exists because of the ideological commitment in this country to anti-government principles and ideas, and also the greed of people who want to get their hands on, something like $300 billion or whatever it is of veterans' healthcare money and benefits. But I think we have to be super careful, and healthcare reformers have to really educate themselves to talk to veterans accurately, and also to appeal to veterans about joining the struggle for healthcare reform, because I think often a lot of liberals and people on the left side of the spectrum sort of write veterans off as being a bunch of, like wacko militarist nutcases. They don't know about Veterans for Peace and all these other groups like Common Defense. So I think we need to also strengthen our arguments to go to veterans and encourage them to join in this fight for a system for everyone, like the system that some of them, not all of them, benefit from, and that we really need to save. And we need, as healthcare reformers, to fight very strongly to prevent the privatization of the VA. So thank you so much. I'd be delighted to answer questions, and I hope I didn't go over.
No, that was wonderful, Suzanne. Exactly. Hopefully, some awesome thoughts to just prime this conversation tonight. Thank you so much for being here. You're a national treasure and amazing writer, and spending time with Healthcare for All Oregon and our activist advocates here. It's so appreciated. So we are going to hold on questions till the end, but if you have a question, feel free to drop it in the chat right now, and we'll make sure that we do get to it. Thank you so much again, Suzanne. Next up, we're going to hear from somebody who's been an active user of the VA, both that old VA before the Ken Kaiser revolution, as happened in the 90s, as we like to call it at the VA, but also the new VA, the VA of today, where we really truly deliver the best quality care, the best care anywhere. There's a book about it. Dan Shea, would love to welcome you to the mic and share your thoughts.
Well, thank you. It's a great honor to be here, and of course, I learned so much from Suzanne when she's presenting her books. Of course, have educated me on the history of VA. I want to try and share a little bit of this PowerPoint if it works. So if I can do this again, share, do it.
I'll let you know when we can see it.
Okay, let's see if that works. Why is it not doing it? We had it up there before. There we go.
Something's
Okay.
happening. There we go. You're good.
Okay, so mainly, even as we're talking about, I'm also on a committee of Veterans for Peace, which is Save Our VA. I'm not as active as I was, but in 2020, when COVID started, we had gone to Washington, D.C. to sort of lobby on the issue of Save Our VA. And we had, of course, also ONA and American Federation of Government Employees, all of us in Washington, D.C., speaking to our various representatives to get them to understand exactly what we're talking about right now, why the VA is important, and to stop what Trump introduced as the Mission Act, which is the beginning of really um, trying to privatize the VA. So that was just the beginning. And then, of course, one of our veterans papers published something. And I carried this at the VA with a story about it and just stood there with it because you're not supposed to hand out stuff to people at the VA. They say it's political. But if people come up to me and ask me, "Hey, can I have that?" I was able to give it to them, and they took it and read it, and they were thankful that we were there. When I'm up at the VA, I often am wearing my T-shirt, "Save Our VA," and I will go ahead and begin after I go for treatment. I'm an Agent Orange victim, exposed in Quang Tri Province as a machine gunner, Marine Corps grunt in the jungle, one of the highly sprayed areas, and I actually drank water right from the streams, which was not a good idea. And now I'm being treated for a one of the presumptive cancers for a skin cancer, a T cell non-Hodgkin's lymphoma, and I go twice a week for sort of a derm light treatment and some medications that they give me before that I put on it. For these events. They're supposed to work kind of together to try and keep it at bay. So that's apparently going to be for my lifetime to do that. The VA is taking care of me. They found what was bothering me that started off with a rash. So I look at the VA as really keeping me alive and keeping me as healthy as possible. While I'm there, it takes more time for me to take off my clothes and put it back on than to get the treatment. And afterwards, I go, try to get my steps in. So there was a sky bridge at between the VA and the Oregon Health Science University. And when I'm on this is the sky bridge here. When I'm on the sky bridge, I saw these panels about sort of the history of the VA system, and I thought this was a very positive way of looking at it. And I actually went to them and asked them if they could give me these posters so that I could prepare um, a PowerPoint like this. They would not give it to me, even though I talked to them. We have to get permission to do that. So I took pictures of it and I tried to create it myself. So this is they have we are VA research. Um, Century of Discovery, and let's see the next one. It goes here. People don't realize. So, like the roots of the VA healthcare started, about 150 years ago. The Department of Veterans Affairs evolved from the very first federal veterans facility established for the Civil War soldiers and sailors of the Union Army, known initially as the National Asylum for Disabled Volunteer Soldiers. On March 3rd, 1865, The month before the Civil War ended, President Abraham Lincoln signed a law to establish the National Soldiers and Asylum, renamed the National Home for Disabled Volunteer Soldiers in 1873. And the story goes on. I don't want to get into much of that, but it gives you an idea of the origins of the VA. And this is it's a constant learning process for me. And I'm so interested in what's happening. And I saw these things, and I was basically working on these all day yesterday and today, and trying to find matches to these posters. And the VA experts pioneering 100 years of medical progress. The VA has been instrumental in advancing medical knowledge, improving healthcare for veterans and civilians alike. People forget that a lot of this research is not just for veterans, but for our communities and for the hospitals out there. Research is shared, and it's something that people have to understand. In the private industry, they want to, patent it, and they want to profit off it. They don't want to share this information, but this is a public event, publicly funded. So they're involved in cardiac care for VA research, led to the development of implantable pacemakers, life-saving devices, regulates heart rhythm by delivering electrical pulses. They had smoking cessation, nicotine patch, diagnosed many different things here. So I just wanted to share this as quickly as possible, and um, this is our successes, transforming medicine, making history. The U.S. Department of Veterans Affairs has made significant contributions to medicine, healthcare through various innovations and research advances. Suzanne's book actually talks about these things and really gives a great history on the innovations and the importance of the VA's research and how it affects all people, not just veterans, but all people in the medical field. It established a National Center for Post-Traumatic Stress and developed a cardiac pacemaker, nicotine patch, innovative surgical techniques, and telehealth innovations. So these are just some of the things that you're starting to see in the private sector, but it began here. And I think that's all I had on that. I thought I had another one here. Let's see, why is that not doing it? Oh, well, anyhow, the main thing that I wanted to say, is talk to you about my personal experience with the VA. And let's see if I can stop this sharing part here. Just close it out, maybe. There we go. So one of the things is that as a when I first came back from Vietnam, I didn't want to talk about the VA or I mean not the VA, about my military experience. And part of that was, I was hyper vigilant. I was um, uh, really always prepared for a fight. I was always kind of looking over my shoulder. So this sort of sense of always being hyper aware, having to sit by the door, making sure that nobody was coming in. It's based on paranoia, and then I got married, had my first child. My first child was Casey. Casey was born with a congenital heart disease, left cleft palate, and other abnormalities that I later would learn were related to my exposure to Agent Orange. And these kinds of things, scared the hell out of me. And we didn't know when my son was born. They kind of whispered off to the side, and then um, they came to me and said they think he's got blue lips, so it's a sign of his blood flow isn't working and possibly a heart problem. And as they got a pediatrician to come speak to us, he had a seizure, and all of a sudden it was emergency, and they were rushing him up to Dornbecker at OSHU and ICU. And my wife, after just delivering Casey, got up off the hospital bed and said, we're going up there to take care of our son, see our son. And we were up there almost immediately. And we began to, he was in an incubation dome and with, tubes in and out of him everywhere. We didn't know if our son was going to survive. I mean, you just understand the fear that a parent has when something like that happens. Now, one fortunate thing, which is in Portland and in Oregon, they had a system that if your child was born with a congenital heart disease or a birth defect of some sort, that because we have a research hospital, that they actually would fund and pay for all your medical expenses for your child up to age 21, I believe it was. And so Casey had everything available to him: pediatricians, heart surgeons, um, I can't even think the names of. We had like 3 pediatricians. We had social workers come and work with us. We learned from other family groups that their children were born with various problems, and so we would join those groups, and they would explain to us, their children received plastic surgery for their cleft palate. So, and Casey had his, he was born in February 16th, 1977, and he would be 48 years of age today. But he had his surgery. My daughter was born just a year later, and Casey had his palate fixed when he was 2, and then when he was 3, he had to go for heart surgery. A heart surgery that had one of the best doctors around, Dr. Albert Starr, heart pediatrician who developed heart transplants and valves for children and adults. And I just talked to a friend, a veteran, who just told me that he had Dr. Starr do his heart surgery. So he continues to be somebody that was world famous. And the thing is that it took 10 hours of surgery. Something went wrong. Casey went into a coma, and he was in a coma for 7 weeks.
We got some chicken nuggets for you though.
Oh, I think we have a hot mic on there. I don't know if that's Tony or who, but go ahead, man. Sorry about that.
Yeah. So the main thing is that Casey went into a coma for 7 weeks and died. He was holding him and rocking me. He died in my arms. And so what happened? Everything just disappeared for me. And why I'm still here today is because I had a daughter that was just a year younger, and I had a wife that I love very much, and we are still married to him for 54 years. And the thing is that uh, I began to understand, what it was for those Vietnamese children that are born with birth defects, the children that we were sent to kill, that we bombed in their villages and destroyed and saw their lives disappear. I know how it felt to hold a dead child in your arms. And that's what really changed me and made me understand why I had to speak out for peace and become a veteran for peace. Now, that goes with war after war after war. When I came back, there was the Central American wars that were going on. I was involved in labor and the sanctuary movement for uh, uh, refugees. And then we see right now that we're dealing with, ICE attacking refugees, all of these things. But it started with refugees. It started with going after the other. It started with Black Lives Matter. It started with, this continuous racism that was going on, and xenophobia. And when Trump started at the border, and was having ICE agents and Border Patrol take children and rip them away from their parents and put them in cages and start deporting families. That was, the first time he was there. That was just the beginning of what they were going to do. And to imagine that he would come back after all of that and the insurrection that they had on January, was it 1st or 2nd, 6th, whatever it was, and the violence that they did, all of those things had something. So it has a mental capacity that creates post-traumatic stress and moral injury for me. And the VA is an area that aids me. I go for mental health once a month, and I should say that they were send me out to a private psychiatrist, and they sent me out to a private psychiatrist when I was going through a mental breakdown because of all of this stuff. And that person did not know how to handle veterans and actually sent me into deep depression. And I had to go up to the VA center in Tacoma, Washington, VIP program, in which it was 5 weeks of residential care and both private and group therapy. And they had 3 different types of things for veterans with veterans that were homeless, veterans that had drug and alcohol abuse, and of course those of us that were with post-traumatic stress and moral injury. And we were all in the same building, but when you see what they were doing, some of the people have been there for years. They have not been able to get out because of what had happened. And that's the kind of stress that veterans have. And the thing is the hospital helped me cope with what I'm doing. And that's what I continue to praise the people and the doctors. When you say,
Yeah.
when you say to me, thank you for your service, that bothers me because I say, you're thanking me for killing other people. I cannot take that. But I want to thank the people that are working in the medical field. I want to thank the people at the VA. I want to thank all of you for caring about veterans. And I understand that people mean well, but understand what this is really about. Thank you.
Thank you, Dan. Dan Shea, everybody. Dan, thank you so much for sharing your story, your family story. Casey and I born just a little bit apart there, and I know that I just really appreciate it. It's illustrative of the fact that even if the VA care, there's the families and the damage that war inflicts is not just on the service member itself, but in an intergenerational way. And sometimes you were in Oregon, but sometimes our family members can't get that care that they need. So thank you so much for sharing that story and your personal experience, and also bragging about the innovative things that the VA does from a research standpoint. All right, before we get to questions, y'all, I hope you have some good questions. Drop them in the chat. We're going to hear from Betsy Zucker, an awesome friend, an awesome activist, an awesome leader. Betsy, I can't wait to hear, because I've never really heard you talk about your VA service. We're always talking about other big picture political stuff. So I'm looking forward to it. Go for it.
Yeah. Hello, everyone. And thanks, Valdez, Suzanne, Dan, for really wonderful presentations. I am Betsy. My pronouns are she, her, and I'm based here in Portland and really honored to be here with all of you. As Valdez said, I'm a retired nurse practitioner and spent 15 years at the Portland VA after working in other settings. I found that the VA actually put patients over profit. Employees were unionized, mission-driven, civil servants, and about a third of them at the VA were also veterans themselves, which really makes a big difference in the setting. And eventually I met Dan and Suzanne, from whom I have learned so much more about veterans and about the value of the VA. When you work someplace, sometimes you don't get the biggest picture. And from that point, I also became involved in advocating for single-payer universal health care. As Suzanne has already described so well, the integrated comprehensive healthcare system of the national VA is so different from the rest of our fragmented healthcare non-system. The VA not only funds, but directly delivers healthcare to over 9 million veterans. And that care provides strong coordination of care, as well as a focus, as you've heard, on the many specialized needs of veterans. Many folks outside the VA don't realize that research has consistently and surprisingly to so many demonstrated that the quality of VA healthcare is as good as or superior to that available in the community. And it's something for our single payer community to learn about. I'd like to share just a couple of personal examples of the great ways that the VA's public health orientation and its deep commitment to addressing the social determinants of health can and did improve healthcare. As an NP, I was deeply involved in the treatment of veterans with chronic hepatitis C. For many years, the only treatment was long and difficult with many physical and psychological side effects. Partnering with my mental health and social work colleagues at the VA, we were able to successfully offer treatment to many veterans who were considered way too high risk at other Portland area clinics. And it was only because of that teamwork that we were able to do that work. Later on, truly wonderful antiviral medications were developed for hepatitis C. They're often curative in just 12 weeks, few side effects. The price tag, though, it remains tens of thousands of dollars per course of treatment. The VA was able to negotiate nationally for the best price anywhere, although still ridiculously high, and actually instituted a system-wide campaign to find enrolled veterans with hepatitis C and offer them treatment rather than creating barriers as was happening elsewhere. This, to me, is part of what the VA does so well. It recognizes problems that are happening to individual veterans and groups of veterans and hops right in to address them. So something that we haven't talked too much about tonight is that the VA has really, as wonderful as it is, has been plagued by understaffing for many years, with tens of thousands of vacancies at facilities around the country. Instead of recruiting clinicians and strengthening the VA itself, legislation and funding are prioritizing outsourcing of care, and this has created additional administrative burdens, worsened coordination of care, worsened quality of care often, and increased costs. We are now, under Trump, also seeing additional attacks on the VA, its workers, and their unions. Many are fighting back, including veterans groups, unions, and others like the Federal Unionist Network. But private equity, third-party administrators, and private health systems are just chomping at the bit to try to make a profit on veterans' care on the government dime. And this is regardless of the fact of the limited capacity, timeliness, or understanding of veterans' issues by private medical and mental health providers, as both Suzanne and Dan have explained tonight. Everyone needs high-quality health care. Certainly, there are veterans who don't utilize the VA because they prefer not to or aren't eligible. They need health care, as do their family members, their friends, and the broader community. And VA patients also need a robust community health care system for those times when they need specialized care or surgery or are too far away from a VA or have an emergency. they will always need and be referred to care in the community, just like anyone else. We all need a fully funded, universal healthcare system, even as many of us fight for a properly funded and staffed VA. I'm going to end tonight by repeating what veterans chanted yesterday at an inspiring Veterans Day event. No cuts, no ICE, no occupation of our cities. So let's work together to build what we do want. Healthcare for everyone, universal, publicly funded, veterans and non-veterans, here in Oregon and around the country. Thank you so much.
Oh, thank you so much, Betsy. I love the motto. I love the motto. We need to do that. No cuts. Thank you so much. So now we're going to be moving into our Q&A portion. We've got about 25 minutes. This webinar goes till 7:15. So we will do hands raised, but I also have some from Rick, and I'm mining the chat for some questions that you all have. One thing I did want to start off with, though, as a question is, so, you know, I shared a little bit that I was at the VA. I worked there for 18 years, from the basement to the, you know, the C-suite, so to speak. And positions of increasing responsibility. And I had the opportunity to oversee primary care at the Portland VA and all of our 13 clinics. And Dan went to one of ours. And so, but a lot of people aren't going to the VA because so this is just a public service announcement. When you're talking to folks that have served, ask them if they're getting their VA care, because so many people are like, well, I'm not a veteran. I was like, well, did you serve in the military? Yes. But a lot of veterans have these, we self-describe and self-identify in a way. Some people think they're not a veteran unless they got deployed to a foreign, you know, went to a foreign country, or they were in a combat zone, or they got up, they have a Purple Heart that they got shot at or injured on the job. People that serve, military service wreaks havoc on veterans during peacetime just as much as wartime, because it's just hard service. Just being away from your family and being uprooted and going off from the people you love is a sacrifice in itself. So a lot of people aren't going to the care because they either have insurance, they're ineligible because of who they love, the type of discharge they got back in the day, a lot of conduct reasons. National Guard folks, a lot of people don't realize that National Guard folks can't get VA care. So there's a lot of reasons why in Oregon there's 266,000 veterans and only half of them are enrolled at the VA. So there's 133,000 odd veterans that would definitely not getting care, that are maybe getting bankrupted and having medical debt and all the horrors that go along with the medical healthcare system. There's a better way. So I was going to ask Suzanne, actually, can you just kind of speak to, you know, any thoughts there about like why the kind of folks that are left out of the VA care? Like, we want everybody to get the VA care, but there's a lot of people just structurally, policy-wise, that aren't able to get it, that might be dependent on non-VA care.
Yeah, thank you, Valdez. I think most Americans think that every person who served in the military is eligible for VA care. I mean, I hear that all the time, and that's, like you said, totally not true. The first thing is you have to get the appropriate military discharge, which is still, you know, they're giving these other than honorable discharges as and general discharges, which the other than honorable means you can't get any VA benefits at all, or education, which they promised you. It's very complicated, and we need Congress to stop the military from, you know, giving these discharges out. And then there's a general discharge, which you can get VA care, but you can't get education benefits. So the good news is, if the VA puts you back together and you're ready to rock and roll, and you want to go to school, you can't. You know, you can't get the promised benefit that you were promised when you enrolled. That's about 1 million people right there who we need to, you know, the VA could be mandated to cover those people, and Congress should do that. I think every veteran, I mean, in my view, every veteran should, you know, maybe, you know, dishonorable discharges. So, I mean, that's a very small, tiny amount of people, and, you know, they've committed murder or whatever. Okay, you could maybe leave them out, but every veteran should be able to get access to VA care and benefits. I think we should also have every family member of every veteran be able to get access to VA education and benefits. And Philip Longman suggested that in his book, Best Care Anywhere, a long time ago. And I think single payer people should really go for that because, if you had covered all veterans, it's 18 million people. If you added in their dependents, I don't know, what is it? Multiply by 2, 3, who knows? That's, maybe 60 million people that would be covered by a socialized medicine system. I personally think that that's what our strategy should be. In the interim, though, you need to cover these veterans who don't have coverage, and so there's various ways that you could do that. But I really think that healthcare reformers should, get on the bandwagon of expanding. I mean, there are some people in the healthcare reform movement, tragically, there's some people everywhere where the perfect is the enemy of the good. And, oh, that wouldn't be pure single payer, or, oh, that wouldn't be this, or, oh, that wouldn't be that, or, ironically, many veterans would be opposed to this because, I mean, interestingly, there are, veterans are, I think, often harder on each other than non-veterans are hard on them. But there have been ideas, like in the 1996, there was an idea that was proposed by the Legion, amazingly, the Legion, to allow people to buy into the VA like a kind of managed care, system. But so it's super complicated, these eligibility requirements. And it's ludicrous for somebody to think, oh, I wasn't in combat, I'm not a veteran, or I don't. A lot of people also think, and I'll shut up after this, a lot of people also think that, oh, if I enroll in VA, and this is super common, I'm going to take it away from somebody else, as though it's a sort of a, zero-sum game. That is not how the VA budget is determined. They are actually hurting people by not signing up. Because the VA budget is determined by how many people were, use the system in prior years. So it's not like if you don't use it, somebody else is going to get it. And so, but what all this attests to is that there should be a default opt-in when you leave the military. Everybody should be allowed to get care. We should staff up. And then, in underserved places, the VA could also help serve communities, like in White River Junction, where there's a declining veteran population. They're now letting, White River Junction, Vermont, they're letting non-veterans use mental health services at the VA.
I wonder if Bernie had something to do with that. That sounds like a Bernie idea. I love it. Connor, you are on deck.
Hey team, joining from Colorado today. Health IT person of about 10 years now. Just wanted to thank you all for showing up, telling your story, and connecting us all today. It's been a lot of fun. Yeah, have some experience working with the DoD, VA, and now IHS, Indian Health Services, as part of their EHR modernization program. So love this topic. I know there's been a lot of challenges or stories that I've heard about, the transition from DoD to the VA, and all of the, the patients carry on their binder with hundreds of pages, or, their wives or spouses or caregivers having the challenge of having all their information in one place as they seek care in the network or from state to state, etc. So I think kind of questions on how healthcare for all at the Oregon level. And Dan actually mentioned this, how he went to Washington to actually seek some mental health care too. So I'm curious how like a state program could help with some of these interoperability challenges for folks in Oregon.
I'll take a swing at that one. So, we have a Universal Health Plan Governance Board that is actively building a Universal Health Plan here. 9 members on it. They're going to be pushing recommendations out, publishing next September 2026. Where we're at right now is kind of more like the Canadian version, where they kind of Saskatchewan went first as the first province, and then the other provinces followed. So right now we're kind of looking more at a system that would be freedom of choice, still maintaining, you know, I know VA for all would be like the gold standard, but where we're at right now is where it would at least rechannel the money that's already being spent on Oregon to stay within the state, to negotiate down the farm prices by negotiating as one state, one whole system like the VA does, which is the reason that they pay 10 cents for a pill that other people are paying $10 for a pill. And then, you know, there could be some kind of, you know, Epic is a big one, you know, Cerner, those are kind of the two big EHRs. But if you had some kind of, you know, EHR for all to accompany this, it would that would help with the cut down on the fragmentation and bring it all into one system. But the big immediate savings right now is that our projections show that we could bring everyone into the system and save $800 million a year as a state. Now, those things are getting operationalized, and there's a finance committee that's part of the Universal Health Plan Governance Board looking at that. But our sense is that instead of having a financer, an insurer, a deliverer, and a payer, if the state was essentially a state-sponsored universal health plan, like the you know, insure for all, like a public, you know, insurance plan, that would cut out the I on that equation, and then the money would just be going into the system and to the nurses, the doctors, the healthcare systems that are actually providing care, to include places where there aren't currently care possible, as birthing centers and other hospitals in rural areas close. And the money would stay in the system. It would stay in Oregon. It wouldn't be going back to Optum or United Health or someplace back east. It would be here. And oh, by the way, people wouldn't be getting denied care because of profit motives. Dan, did you want to add on to that? You're still muted. Yeah, there you go. There you go.
On my mute there. Yeah, one of the things I wanted to just add here when you're talking about healthcare, a lot of the veterans that don't go to the VA, if they're working and they think that, you know, their job is providing their healthcare for a long time, you know, my job took care of my healthcare, but you know, it was taking out of my wages. It was reduced my wages because I had to pay for it through my wages. The other is that it was also, I had copay. And these are just other ways in which you're constantly being charged. You shouldn't, you know, people shouldn't be profiting off of people's health care. It should be a universal right. Healthcare is a human right, and I think that's what people have to understand. That's what's so important about why the VA. More people should look to the VA and not just end up paying a lot of money that they don't need to, even while they're working in some union job, etc.
Thank you, Dan. Thank you so much. Good question, Connor. I got this question actually before the webinar, so I'm gonna think maybe this might be a Suzanne one, but Dan or Betsy jump in. Somebody told me they said universal health plans need to think through veterans benefits and VA. I would love to hear your thoughts on private programs like Champus. You know, I think we could also talk about TRICARE. This is a fun fact. I went through the MHA MBA program with Army Baylor, which is where they're training the military officers to run the military treatment facilities. You know what the single biggest thing bankrupting like the DoD right now, other than, you know, bombs and, you know, that kind of stuff, is the healthcare costs. The military health system is this big albatross that they're looking at trying to figure out. And the nickname in the Army, or when you're in the military, is for the dependents, the family members, they call them dependents, try to get care instead of TRICARE, because, you know, it's the same system where does the care exist in the community, and then you're still working with a third party administrator to manage it like the VA does. So Suzanne, could you maybe speak to, like, you know, intersections just in terms of like Champus, TRICARE, you know, VA?
Yeah, Champus and TRICARE are just payers for private sector care. I mean, the military health system had, you know, military hospitals and clinics where people could get care. I mean, places like Walter Reed and Brooks and blah, blah, blah. My understanding is that TRICARE and Champus are basically just paying for private sector care, and they've done a lot of privatization. I am not an expert on this, but they've done a lot of privatization of the military health system, sending dependents out to Champus. It's mostly TRICARE now, I think. Is Champus still exist? I think it existed. Whatever. It's definitely TRICARE, and they realized that, you know, people were getting crappy healthcare in the private sector, and they didn't understand their problems, and they decided under Biden that they were going to reverse the privatization. But now under Trump, you know, who knows? But I think that so you know, the problem is that you're just sending people into our broken healthcare system, our broken fee-for-service healthcare system. And that's what TRICARE is. That's what the Veterans Community Care Program is. And it's, you know, it's pretty interesting because before the Veterans Community Care Program, when you looked at studies of VA veterans compared to, they used to compare it to Medicare, you know, and private insurance. And the VA always did better. But it was sort of apples and oranges because they weren't necessarily veterans in those systems that they were comparing outcomes to. And now with the Veterans Community Care Program, we have studies that compare apples to apples, which is veterans who are getting care in the private sector and veterans getting care at the VA. Let me cite one stunning study of 500,000 ambulance rides where they took Medicare eligible veterans and who were dually eligible, they were also eligible for VA care, to either that randomly took them to private sector hospitals for an emergency or to the VA. And veterans who went to the VA were 2 times as likely to live in the first 30 days and went to private sector hospitals 2 times as likely to die in the first 30 days. To pay for those deaths, it was 21% more expensive. And veterans, you know, lived longer, and that veteran, what the researchers call the veteran advantage, lasted for the entire year because they got coordinated care at the VA, which they didn't get in the private sector. And I remember reading that study and saying, why can't I go to the VA? I mean, you know, like, and so VA care is better. It's integrated care. It's better. It's, you know, mission driven, not profit driven. There's no incentive to give more care or less care because people like Betsy were on salary, right? They didn't, you know, oncologists don't, you know, they have no incentive to offer you that last 2 rounds of chemotherapy that you don't need as you're exiting life because, you know, they don't get, they don't lose the revenue from a patient if they send them into hospice, which they do now. If you send a patient to hospice, you lose revenue. And they don't lose revenue from marking up chemotherapy drugs between 110 and 600%. I mean, there's an incentive. You know, it's a perverse system. We have a system that has perverse incentives to overtreat and, ironically, perverse incentives to make mistakes, because every mistake, you know, preventable medical error, unless you just die right then and there, it's more treatment, more visits, more saline solutions, more meds, you know. And I mean, the VA has none of those incentives. We need that kind of system. We need to promote that kind of system. We need to talk about it. And bloody hell, we need to protect it to make sure that they don't destroy it. Because right now, and Rick Stangenberg asked me a question about this, they are, you know, they in the FY budget request for 2026 says it all. Collins, this dreadful zip blank, this dreadful person who knows nothing about healthcare and is the head of the largest healthcare system in the country, has requested a 54% increase to pay for private sector care and a 17% decrease for in-house care. That says it all. I mean, they're understaffed. They were already understaffed. They're cutting staff everywhere. He said he's going to not fill 30,000 positions. In a healthy organization, if you have attrition, people leave for retirement. They leave because they died. They leave because they got a new job. You fill those positions. That's a sign of a healthy organization. He's not going to fill those positions. And already we're hearing terrible stories about people getting delayed care. And then I put in the report we did on private sector care. Where are they going to get care in a private sector system in which 123 million people can't get mental health care and 89 million or something like that can't get primary care? So good luck finding care in the private sector if you're a veteran or anyone else. And then all of this is going to get so much worse in just a nanosecond because of this big, beautiful bill.
I just wanted to add on to that. So somebody had asked about the staffing crisis. I think Suzanne kind of talked about it right there. The thing is, veterans have always been like the third rail that like politicians won't touch. And like we were talking about yesterday at Veterans Day, like they always said like the VFW, the DAV, the Disability American Veterans, and the Paralyzed Veterans of America, and the Legion, they would never let them get rid of the VA or go out to the VA. But what they're doing is so evilly genius. What they're doing is they're posing it as, oh, look, the VA can't provide the care, so we're going to give you the option to go out into the community. Here's the thing. When that money goes out and somebody actually does go, the VA cannot claim any credit for that care, the community care. The only thing that happens for the VA's budget setting processes, there's this big machine, it's called the Veteran Equitable Resource Allocation Model. You can only count the care that the VA provided. So when they slow roll the hiring, you can see less patients. When you're sending more patients out to the community, you can see less patients. When you create challenges that create access issues, you can serve less patients, you serve less patients. And then you serve less patients, that's less money for that next budget cycle. Wash, rinse, repeat, downward cycle, and that sucking sound is just all the money going out. But the thing is it's for veterans' choice. I'm getting them the care. They can go out and they get the care in the private. It's a very kind of a sad situation. I did.
And also what they're
Yeah.
going to do now
Yeah.
is they're going to say, well, if all these veterans are going to the private sector, like they don't want to go to the VA, so why should we maintain the VA? I mean, this is like this is so perverse, because what they're doing, there is no healthcare system in the world, no business in the world that sets up its own competition and then pays for people to go to the competition. I mean, imagine if the Dallas Cowboys said, don't come to our games, go to the, oh man, I'm in bad shape because I don't know who go to the Patriots, that they're football team, right? Okay. So, and by the way, we'll give, we'll pay for your flight to Boston from Dallas, and we'll put you up in a really nice hotel. And, I mean, this is incredible. I mean, and my feeling is at some point, somebody needs to say to veterans, we built you a system. We spent billions of dollars over 100 years to build you a healthcare system that's specifically designed for your needs. If you want to go someplace else, pay for it out of pocket like everybody else does. But we cannot afford to give you two parallel healthcare systems. And because of that, what's going to happen is the VA is going to die, and then you're not going to have that. And then you are really going to be in the soup.
All right. Thank you, Suzanne. As we start wrapping, I'm looking at these questions here. I want to share a quick thing and ask each of the panelists to just kind of comment, and then I've got some call to action stuff that I want to share with you. But I want to just say, I remember a friend of mine at the VA. His son got married. The father of the bride he was the father of the son. He basically was talking at the reception. He's like, hey, do you think I could get VA care up there? He said, are you a veteran? He goes, yeah, Vietnam. He goes, yeah. This is a guy that had served his country, the late 60s, early 70s, had gone without care his whole life. He was in a car business, and so it did not invested in his own care, and had been having some heart trouble. Went into the ER. They scanned him. They screened him. He was they said he was a ticking, situation. And he basically, they ran him up. He got heart surgery that day, kept him in, and he's still living and probably holding the grandbaby of that marriage 15 years ago. That's the kind of stuff happens all the time. So I just wanted to, as we quick closing thoughts from, I'll start in reverse order. Betsy, maybe you saw veterans like that, or people that refuse to come in, or you just see the value. But anything, Betsy, then Dan, and then Suzanne, closing thoughts, and then I'll do my call to action.
Of course, I saw patients like that. I took care of patients with liver disease, and I saw patients who got such poor care or no care in the community that they came in liver failure, and we could have taken care of them for years before that. Check.
Any other final thoughts on Betsy as we kind of go out? And you're such a long time activist.
I mean, the support for the VA and the support for universal publicly funded healthcare are two sides of the same thing. We should all be advocating for a robust VA system, as well as however we get to universal publicly funded for everybody else also.
Okay, thanks. Dan?
One thing, I guess I did unmute, I think.
You're good. You're good.
The one thing that that I was just thinking about is that you know, when they talk about jobbing things out and privatizing the VA, they're not going to get rid of the VA. They're going to turn it into an insurance company, and they're going to pay out to the private industry. That's what it looks like to me, and I think that's what we have to. That's what we fear the most, because we really want a system that isn't an insurance company that decides what your health care is about, like we do in the private sector. We want a system that actually takes care of your health, and that the VA does. I also just wanted to say, that since I'm an Agent Orange victim, we have Rashida Tlaib introduced two new bills for Agent Orange in the Congress, and one is HR 3052, Agent Orange Relief Act of 2025, and its purpose is to actually, my son would not have been covered under the VA. Because he would not recognize male veterans' children and with their birth defects, and we're asking that they would recognize female veterans' children with these sort of birth defects, but not male veterans. Why? Because there were more male veterans than there were female veterans. They didn't want to put the money out on that. So that's one thing we're asking them to actually recognize us as equal, as to take care of veterans and their families and children that are affected by Agent Orange. The other is another bill, which is HR 3051, Victims of Agent Orange Act, which is really looking at the Vietnamese community and the Cambodians, the Thais, anybody, the veterans that people that were actually affected that we sprayed, and that their children and their families, they need to investigate and see whether we can reduce their suffering also. So those are two bills that people can actively support. In this Congress, I think it's hard, but you at least need to continually try to make these efforts go forward. So that was one. And just to let you know that, I'm going to be going, I have neuropathy also. I'm going in for tests here, certainly for that recently. And I had some other problems that my primary has sent me to. I'll be going for an MRI on my brain. So I'm either a genius or I'm going crazy. One of the two. Thank you.
Hey, maybe I'll see you up there, Dan. I get my care at the VA still. I do have Kaiser through my employer, but I still get the VA care as well, because like I said, if you're a veteran or veterans, the biggest thing you can do is enroll at their local VA and wait out for that in-house care when they can. Suzanne, final thought?
Yeah, I mean, I think we need to be fighting for a system that's a payer and a provider, because the reason why the VA has been able to innovate is because it controls the practice, and Medicare is not very effective at that. And we also need to get rid of fee for service, which is, in my view, the devil incarnate. And we got to put everybody on salary. I think that, one of the things I noticed when I was writing my book, and even now, is that many people, because of the socialization they undergo in the military, they don't get care when they get out of the service right away necessarily. And I'm sure Betsy saw this, that sometimes it takes them decades, like literally 3-4 decades. I've been in peer support groups for PTSD folks who were in Vietnam 30-40 years ago and just came to the VA to get help. So you need a system that's going to be there now and 30 years later, because these young folks, they have to have a system which is there for them, not merely when they get out of the service, but in years to come. And that's true of all of us, right? We need a system that's going to take care of us for our lifetimes. So I just think we have a huge opportunity here. This is a government that throws stuff on the wall and sees what sticks. And if you fight it and make a fuss, it doesn't stick. So we have to be vigilant. And it's not just veterans or their families. We have to be vigilant and protest and go to our legislators and even Republicans. You know, the Republicans are now very vulnerable, super vulnerable. And we just have to raise a lot of hell and talk to a lot of people and get more people. And I am really excited because I'm having conversations with veterans now that people would have shot me if I tried to literally, or beat me up, or maybe because I'm a woman, they wouldn't, but you know, they would have really been not so nice 2 years ago if I'd had these conversations. So I think we can have conversations with veterans like you all are having in Oregon. And I think we can have these conversations all over the world. I mean, not over the world, but all over the country. And I think that we have to fight for what we want. I mean, the right wing, you know, the minute Roe v. Wade was passed, they organized again and they waited 40 years. They didn't say, oh, it's not realistic. We can't really do that, you know. And we have to really fight for what we want. And I think what we want is a universal healthcare system. And we should be fighting for that. That should be our you know, negotiating point. And then we may have to get something less, but I think we should start that now. And I'm very excited to be here. I hope you'll ask me to come back again. And I really would like to be part of your movement. And I'm so excited. I can't tell you, it's just great to spend an hour and a half like this with folks like you.
Thank you so much. Thank you, Suzanne. Really appreciate it. Thank you, Betsy, Dan. Thank you, all three of you. We're getting close to the end point. I do want to share just a little bit of an action. It'll just take a minute or so here. Thanks for tuning in tonight, y'all. Healthcare for all who serve, replacing the VA, or reinforcing the VA, not replacing it. I did want to just share this QR code. We are looking for the Universal Health Plan Governance Board is actively building the plan that we hope to hopefully enact and vote on in 2020, as early as 2028. The recommendations are coming out next September. Have you ever heard that expression, nothing about us without us? We're hoping that you all can make your voices heard at the Universal Health Plan Governance Board. This is a QR code. You can go to also email us at hcao.org, info@hcao.org to say, hey, how do I get that testimony guidance? Actually, Pam Code is doing a workshop right now as we speak. And so you can, oh, there you go, pamcode@hcao.org. We would love to hear veterans. We've had labor voices coming, we've had some other voices, but we've not had veteran voices or veteran advocates or military families coming to the Universal Health Plan Governance Board. So if you have questions like one of our participants had here, M. Carolina, would this be a public option available for all and an additional coverage would be available for purchase like they do in European countries? I don't know. That's being decided as we speak. Would the portability, accessibility for Oregonians be based on residency requirements like voter registration? You know, if you ask this guy, I think so, but we don't know. They are designing that in the plan right now. And if we would be the first domino to fall in Washington, California, followed as an example, what would the vision be for the portability, accessible healthcare? We like the idea of a West Coast block, but again, we don't know. But we think that we are going to be the first, and we're going to have to be able to set the tone and pace of everything that comes. So we don't want to let, we don't want to be afraid to be idealistic and say what we actually think it should be and how it should be paid for, and make sure that it's an agenda that works for all the people. So there are chapters of Healthcare for All Oregon all over the state. If you'd like to get involved, there's likely a monthly social event happening near you. Sorry, Florida. Sorry, Colorado. Sorry, New York. But everyone else here in Oregon, we've got chapters all over. You can find more out at hcao.org at our website. What we do is we support the work of the Universal Health Plan Governance Board and try to drive people like yourselves to give testimony. We serve as policy experts when they have questions. And we are going to be hopefully championing and working with the legislators to get them to refer this to the voters. We do that by engaging our community, people power. So making sure that our legislators are hearing from the people, that the people are informed, that they're empowered to help shape the plan. And that's what we do. We advocate and raise awareness on the daily. Things you can do to fit in: sign up to attend a volunteer event on the HCAO event webpage. We have a Discord. You can email volunteer@hcao.org and find out when our HCAO 101 classes are. and learn all about the movement and the history, so you don't feel like you're coming into Act 3 of the movie. We have a drummer corps that communicates with legislators. You've heard of Adopt a Highway? Adopt a legislator. We would love to have you involved with that. And we would love to have you sign up for membership, donating $5 a month or $30 a year. We're primarily funded 95% by individual activists just like yourself. You help us keep the light on and doing this work. And again, there's all kinds of fun volunteering stuff, whether it's going to Timbers games, farmer markets, doing fun things like data entry and everything. But we really want to get your voice heard at those governance board meetings. And yeah, come on out to a social event, low stakes. And again, we have a Discord channel if you're into the whole online community without the emails and chats. So thank you so much for attending tonight. Claire, I think, is probably dropping some links in the chat. Thank you, Claire, about how to volunteer, where our website is, hcao.org. Please consider signing the statement of support, if nothing else. We've got 47,000 Oregonians out there that think that this is the bee's knees and the way to go. We would love to make it 47,001 by you adding your statement of support. But again, become a member, become whether it's a one-time donor, a recurring. People power. Some people got the time, they don't get the dime. We would love to have a little bit of your time to make this real. Working together, we are going to make this real. Oregon will be the first, like we were for medical marijuana, with Deaths with Dignity, the innovative Oregon Health Plan when it came out, and Oregon will lead the way in creating universal health care for all here in Oregon, and we hope beyond. Thank you all so much for dialing in tonight. This video will be posted on YouTube if you want to share it with a friend that was unable to attend, and we look forward to seeing one of our next chapter meetings or an HCAO event. Thank you so much for caring about veterans, their families, and tuning into this work. Please support your VA and the people that work there.